need to continue to strengthen and emphasize our improvement in the cancer system relative to what the patient's view of that is. What we all recognized was that the best way to improve the system was to listen to patients, integrate the patient view of the system into all of our quality improvement initiatives.
My vision for symptom management in this province is that all patients will have their symptoms reported early and treated according to evidence-based guidelines. ESAS is the tool that we're using. This is the Edmonton Symptom Assessment Scale, and we're using it because it's an extremely well-validated tool in a whole variety of settings.
There's an incredible value in having a standardized question that the patient is asked over time, and you can then look at how they're doing. So if a patient comes in and they're complaining of a lot of pain or a lot of fatigue, then you know either you've got a patient that's dealing with their problems in a certain way, or your interventions haven't been very good.
We really strive to be able to identify people who are suffering significant distress. ESAS system picks out 9 of the particularly crucial domains.
The ESAS is more than just the numbers that tell us the intensity. It's an instrument to initiate a conversation, a dialogue, and it doesn't necessarily take much more time than if you didn't do it. In fact, in some cases, it may save us a lot of time and even make our visits much more efficient.
There are things I now talk about that in a given patient-family interaction, I would have either completely missed or ignored or not even recognized that it was an issue.
If I see, as I enter a room, something on the ESAS that triggers me, it's going to lead me to places which I may not have intuitively thought.
As a medical oncologist, I'm quite comfortable with handling pain, with handling weight loss and fatigue, but we're probably less well equipped to deal with the emotional symptoms that are uncovered.
"25% of lung cancer patients report on ESAS either severe or moderately severe depression. Frankly, I was unaware.
I've often thought that my presuppositions when I go in to see patients are pretty much bang on, but of course, you often don't know what you don't know, and the ESAS has really brought that out for me on a number of occasions.
Our purpose as oncologists isn't just to treat the tumor. Of course, we have to do that, but our purpose is to treat the patient and get them back into living their life again.
Had a very young woman who has been struggling with a liver tumor that we were able to overcome. She continued to be quite tired. She went through a big surgery, and that was causing her some anxiety as regards to whether the tumor came back or whether there was something affecting her. That ESAS completely changed what I would have normally done. I would have said, you know, it looks so great, you don't need to come back for a few months. But instead, after talking to her and understanding that those were highlight problems for her right now, it allowed us to rechange her immediate follow-up into one that more directly addressed her issues.
This really helps to focus in on what matters to the patient.
ESAS has improved my ability to address patient symptoms in a tremendous way.
ESAS is just the beginning of incorporating the patient perspective on a routine basis into care. I've become a great fan of ESAS. You know, is it the perfect tool, the only tool? No, but it's a start, and I think it's been a very helpful start.
This takes us to not just managing symptoms, but I think takes us to a way of engaging patients.
I'm grateful to ESAS to identify those final few issues that we have to fix, and then we can really claim victory in our medical care of these patients.
It really should lead us to a new standard of care. And in the future, my vision is that all care teams regard this whole approach as just part and parcel of normal clinical care.